we have absolutely illustrious panel in this particular discussion today, which is the challenges and opportunities for the healthcare institution. Dr. Sanjeev, the chief of the now world-famous Amrita Institute, which was inaugurated by the Prime Minister recently. But Sanjeev is famous on his own. Let me tell you, ladies and gentlemen, no conference can be complete without his charismatic presence. So he is going to lead this panel discussion today. Last person in the panel is Mr. Saji Mathew. He is the Chief Operating Officer at the Baby Memorial Hospital, Calicut, and they have done a great amount of work in the field of digitization. So over to you, Dr. Sanjeev.
Mr. Saji, you have an interest in health and IT, and you are an engineer. So what would be your take on EMR adoption?
Good evening all. First of all, let me thank CAHO and CAHOTECH organizers for inviting me to this panel, and also to moderator Dr. Sanjeev Singh. The EMR adoption helps us to reduce the error. That is the benefit of having electronic patient records. All kinds of transcription errors can be avoided. But if it originates, for example, if you capture somebody's out of the registration, if you capture the age wrongly, that across the system is the same data that will be reflected. But apart from those issues, definitely it is a benefit. But some of the other initiatives that we have taken in our hospitals to improve patient safety quotient, that is a clinical communication system. It's nothing but a chat between the doctors and nurses. One of the challenges the nurses were saying, the doctors often give verbal instructions, which is when it is in a crowded place, when it is heard, if it is not understood properly, that leads to medication errors and other related issues. So to avoid that one, everybody is familiar with the chat and the WhatsApp. So we integrated this one with our HIS, with the patient, the identifiable information. This chat goes to the doctor along with a cross consultation or otherwise, and they are able to communicate back. And the nurses are in the nursing station, they will get a pop-up, and this is a documented communication, and thereby we were able to reduce the error in communication. So that helped us to reduce, definitely the safety quotient has gone up. The other one is using a wearable technology. The patients are now given, that is in a pilot stage, wearables, especially step-down area. It is for measuring the vitals. Along with, there is a panic button under fall detection, which is also, it's a cheaper one. It helps to, when the patient, at least after a fall, immediate attention. It cannot prevent it, but at least if something like that happens, okay, they are able to immediately reach out. And also panic button is there. It's another form of nurse calling system. So various digital initiatives that is helping, apart from the EMR, these are helping to reduce the errors or the incidents, and thereby increasing the safety.
Right. So thank you, Mr. Saji. I think that was wonderful. Mr. Saji, you being a software engineer, I think who would be the best person to tell us or guide us about this whole challenges and opportunity of digital adoption, be it telemedicine post-pandemic, be it telehealth, be it in IoT, be it any of these wearable devices. So can you just guide us what would be the best way to approach this to improve patient outcomes?
Certainly. I will quote some of our cases to give specific details. Definitely, there is challenges. We are implementing IT systems, or digital transformation is to address those challenges which exist in our health systems. We had various challenges. So those challenges, when we wanted to address the pain points or challenges of our colleagues, that is where new ideas comes, and we look at digital technologies. Now, all of us know the computer, the entire software or the automation is in a level such that the computers have gained cognitive capabilities in parity with the human beings. That is in terms of natural language processing or computer vision, in many other areas in terms of intelligence. So how can we extend these capabilities to solve some of our problems? When I started my career with a hospital, I came from a financial services industry, there the adoption is very high level. As you know, now the digital banking is a high level of adoption is there. So I wanted to extend some of those things that I implemented in the banking system in a hospital. One of the things we started doing is we wanted to empower and enable our colleagues, some of the last cadre colleagues, that's the porters, attenders, the technicians in the hospital. So we implemented a real-time location tracking system, which is like Uber or Ola, will identify where these porters who is holding the mobile or smartphone, all the requests to transport specimen, patients and the documents were automatically directed. The initial challenges, as you know, from coming from Kerala, I was really afraid whether the unions are going to object it, because that's going to take away some of the job when I automate things, and that will reduce. But my experience was it's the other way around. Those people wholeheartedly welcome. Some of them were using the smartphone for the first time. We are no longer calling them porter, we called smart crew members. So it's a transformation, not just digitally for the patients alone, but giving a better experience for our own employees or colleagues by enabling them, empowering them. Why I did that one? So I have these challenges with my clinical colleagues. So now when my last cadre colleagues are using these digital technologies to do their work in a better and efficient way, why not the clinicians to challenge them? So I would say one of the lessons that I learned, okay, catch people's egos in a very positive way, in a constructive way, you will be able to make changes in an organization. So that worked very well. So it's an inverted pyramid way of empowering people in an organization. Really that worked. Some of the work that myself and my clinical colleagues did, one of my colleagues after completing his MD is fully into digital, is no more practicing than few other doctors also very digital savvy. Many of these our initiative is a collaborative initiative. So right from the very beginning itself, I involve all my stakeholders. So when we develop things together, the resistance is less. So to approach it in an incremental fashion, all your innovations need to be in an incremental fashion rather than bringing in a change in a drastic change overnight, which people may resist. When you make innovations in an incremental fashion, so people are ready to. So many of the areas we have adopted technologies and we were able to reduce the error, increase the productivity. So the IoT implementations, we started with this same platform using the Wi-Fi access points and BLE beacons for tracking portable devices within the hospital. Then all our technicians, so starting with the porter, then the technicians who are involved in maintaining facility, IT equipments, biomedical equipments. There also, when a complaint is raised from a desktop, it reaches to the people on duty or based on their expertise. So they will be, so they get an alert, they accept the complaint, then reach out, and we will got a better visibility even for the management to buy in such ideas. And so the management also gets a better visibility and help us in maintaining the quality and in terms of meeting the requirements from NAVH when the auditors comes. It's all digitally now tracked, and we have the evidence in terms of the turnaround time, what is our resolution time. So that is a way we approach. Some of the success stories are like, so how do we approach it? How do we implement or roll out in an organization using our empowering, using a inverted pyramid? That really worked very well. Now we are using some of the wearable technology. That's the smart wearables to do remote. Again, all of us, like the nursing colleagues, they also get 50 or more than 50% of the time is spent non-core areas of work. It's in terms of coordinating things, in terms of making calls and also, or doing very mundane tasks. So how can we automate certain tasks or take away certain burdens from them by using wearable technologies? Or we are piloting certain things, and in progressively we are trying to introduce even including Alexa, which will make the communication, if they wanted to call out a F&B person or a housekeeping person or a facility, let it be directly. Why should it be through a nursing colleague to reach out to such services? So it's by easing them, freeing them from such tasks they can do it. So the opportunities, I would say, there are plenty of opportunities to automate things in their hospital being a complex system. So in terms of especially a multi-speciality hospital, if you look at, it is not a homogeneous environment. Like if you take a factory, many of the production lines are very homogeneous. Here is the heterogeneity, the complexity brings its own challenges to us, but many of the digital solutions will help us to look at the resources, allocate the resources optimally, plan it, meet the demand, and we use many of these in terms of improving productivity. When we started capturing this data, for example, that porter management system, we came to know that what is the demand pattern, where the demand is, more demands are coming. So there we need to have proximity allocations. So it gives a lot of insight, and thereby we are able to run things efficiently. So that's our experience. Technology transformation really helped us, and also that is it's not a like one time. It is an incremental fashion. So when we bring in innovations, and that will definitely, I believe, one day that will help us to achieve the digital transformations, help us to meet the goals of universal health coverage, making the care to the patients at affordable, accessible, and available to the masses.
Fantastic, Mr. Saji. I think that was phenomenal. The way you have adopted technology in your hospital, and I know Baby Memorial, that you have done superb work, both in clinical and paraclinical, and hats off to you. So we now come to the end of this discussion, and I know there are challenges, but there are huge opportunity, and let's encash on this to improve effectiveness, to improve efficiency, to reduce cost, and ultimately patient outcomes. So thank you so much.